For decades, coffee was treated as a guilty pleasure that needed to be merely tolerated, not celebrated as a cardiovascular ally. Cardiologists asked patients to cut back. Hypertensives were told to avoid it entirely. People with any heart condition were advised to switch to tea. This narrative, which dominated cardiology for 30 years, is being systematically overturned by one of the most robust evidence bases in modern cardiovascular medicine. What science has discovered about black coffee and the circulatory system is not just different from what was believed, it is diametrically opposite in several fundamental ways, a distinction that will appear repeatedly and is essential to understand before continuing. There is an important difference between the acute effect of coffee, what happens in the immediate hours after drinking a cup, and the chronic effect, which is what happens in the cardiovascular system of someone who drinks coffee regularly for months and years. The acute and chronic effects are often opposite, and confusing the two is the source of most of the misinformation about coffee and the heart. If you are not yet subscribed, click now on the subscribe button and turn on the bell. Tell me in the comments where you are watching from. Write the name of your city. Mechanism 1. The effect on endothelial function and nitric oxide production. The endothelium is the layer of cells lining the inside of all blood vessels. The principal phenolic compound in coffee, chlorogenic acid. A 150 milliliter cup contains between 70 and 350 milligrams depending on bean type. Has documented action increasing the bioavailability of nitric oxide in the vascular endothelium. Nitric oxide causes the muscle cells of arteries to relax, allowing vessels to dilate and blood to flow with less resistance. Endothelial dysfunction is now recognized as the first detectable step in the development of atherosclerosis. Studies in humans showed regular coffee consumption improves objective measures of endothelial function, including flow-mediated dilation of the brachial artery, the non-invasive gold standard for evaluating endothelial health. Mechanism 2. Adenosine antagonism and the coronary circulation effect. Caffeine acts primarily as an adenosine receptor antagonist. Regular consumers develop tolerance to most acute effects within days to weeks. Studies using fractional flow reserve in cardiology patients who regularly consume coffee show that coronary microvascular function is better in habitual consumers than non-consumers, independent of other risk factors. Mechanism 3. The antioxidant effect and protection against LDL oxidation. Atherosclerosis does not begin with circulating LDL cholesterol itself. It begins with oxidized LDL. Coffee is, by serving weight, one of the most concentrated antioxidant sources in the Western diet. A meta-analysis in Nutrients, reviewing 11 randomized studies, found that filtered coffee consumption significantly reduced markers of systemic oxidative stress. Mechanism 4. The anti-inflammatory effect and CRP reduction. Chronic low-grade inflammation is one of the primary drivers of cardiovascular disease. A meta-analysis in the European Journal of Nutrition, pooling data from 16 observational studies, found a robust inverse association between habitual coffee consumption and levels of CRP, interleukin-6 and tumor necrosis factor alpha. Mechanism 5. Coffee and blood pressure, separating acute from chronic effects. Established fact. A cup of coffee transiently raises blood pressure 3 to 6 millimeters of mercury systolic in non-habitual consumers. In regular consumers, this effect largely disappears due to tolerance. A meta-analysis in the Journal of Hypertension with data from over 400,000 participants found habitual coffee consumption did not increase hypertension risk and in some studies showed a tendency towards slightly lower pressures. Mechanism 6. Coffee and atrial fibrillation, the major revision. The most comprehensive systematic review on this topic, published in JACC, Clinical Electrophysiology, analyzed data from over 800,000 participants and reached a conclusion that surprised many cardiologists. Habitual coffee consumption is associated with lower risk of atrial fibrillation, not higher. A more recent meta-analysis in the European Heart Journal Cardiovascular Pharmacology found a 6% reduction in atrial fibrillation risk per additional daily cup, up to a plateau around 3 to 5 cups. Tell me in the comments where you are watching from now, and if you are not yet subscribed, click the button and turn on the bell. Mechanism 7. The strongest epidemiological evidence: coffee and cardiovascular mortality. The most cited meta-analysis, published in Circulation in 2022, pooled data from 40 prospective studies with over 3 million participants. Compared to non-consumers, people drinking 2 to 3 cups of coffee per day had 12% lower cardiovascular mortality risk, 17% lower heart failure risk, 21% lower stroke risk, and 11% lower acute coronary syndrome risk. Who should be careful? Pregnant women, limit to 1 to 2 cups per day as caffeine crosses the placenta. People with active gastroesophageal reflux, coffee can aggravate symptoms. People with uncontrolled hypertension, temporary caution until pressure is controlled. People with severe anxiety or insomnia, caffeine has a 5 to 7 hour half-life. Coffee preparation and cardiovascular benefit. Filtered drip coffee using a paper filter removes cafestol and caweol, diterpenes that in high concentrations can raise LDL cholesterol. Turkish or French press coffee contains the most diterpenes. Espresso is intermediate. Paper-filtered drip coffee contains negligible amounts. For maximum cardiovascular benefit, filtered coffee is the preparation validated by the research. Medicare and most American insurance plans cover cardiovascular consultations where coffee habits can be discussed in individual clinical context. The chlorogenic acid mechanism in detail. Chlorogenic acid acts by 2 pathways in the vascular endothelium. First, it inhibits the enzyme that degrades nitric oxide, ENOS phosphatase, increasing its local availability. Second, it reduces oxidative stress in endothelial cells, which is the primary mechanism destroying nitric oxide before it can exert its vasodilatory effect. The net result is an endothelium that produces and preserves more nitric oxide, translated into more flexible arteries and less vascular resistance. In people with risk factors such as diabetes or hypertension, where endothelial dysfunction is especially pronounced, the effect of chlorogenic acid has greater magnitude than in those with preserved endothelial function. Coffee and the gut microbiome. The metabolic bridge. A recently elucidated mechanism connecting coffee with cardiovascular health is its effect on the gut microbiome. Coffee is one of the most significant foods for the microbiome, due to its high content of soluble fiber, mainly mannan oligosaccharides, and polyphenols that reach the colon where they are fermented by beneficial bacteria. This fermentation produces short-chain fatty acids, especially butyrate, which have documented systemic anti-inflammatory effect and reduce bacterial endotoxins that contribute to chronic vascular inflammation. The practical recommendation: 2 to 3 cups of black coffee without sugar per day, prepared with a paper filter, consumed after breakfast, is a habit with 7 documented cardiovascular mechanisms and confirmed by decades of epidemiology. The American Heart Association and European Society of Cardiology have removed generic coffee restrictions from their cardiovascular prevention guidelines in the most recent versions. The science is clear. Black coffee in moderation is one of the most pleasurable and evidence-supported cardiovascular habits available. 7 mechanisms, 3 million participants, 1 consistent conclusion. Enjoy your coffee. The science is on your side. God bless you and give you much health. Until next time. Frequently asked questions about coffee and the heart. Will coffee raise my blood pressure? If you are a habitual consumer, practically no. Tolerance eliminates most of the acute effect. If you are a new consumer, it may raise 3 to 6 millimeters of mercury for 1 to 2 hours, then returns to baseline on its own. Can I drink coffee with a pacemaker? Studies in pacemaker patients do not show increased arrhythmias with moderate consumption. Consult your cardiologist, but absolute restriction has no current scientific basis for most pacemaker types. Does coffee raise cholesterol? Only unfiltered coffee, Turkish, French press, or percolated, due to diterpenes. Paper-filtered drip coffee? No. Is decaf good for the heart? Yes, though with lesser magnitude of benefit. It preserves polyphenols but loses caffeine-mediated effects. Studies show decaffeinated coffee also has cardiovascular benefits. Is coffee bad on an empty stomach? No documented cardiovascular negative effect, though it can increase acidity in people with gastritis. The ideal timing per chronobiology, 90 to 120 minutes after waking, when morning cortisol has already declined. Coffee and type 2 diabetes, the additional cardiovascular benefit. The most comprehensive meta-analysis on coffee and diabetes published in Diabetologia with data from over 1 million participants found 25% reduction in type 2 diabetes risk for consumers of 3 to 4 daily cups. This is cardiovascularly relevant because diabetes is one of the primary risk factors for coronary disease, stroke, and peripheral vascular disease. A habit that simultaneously protects against diabetes and against direct vascular damage has doubled cardiological relevance. Arterial stiffness and pulse wave velocity. Pulse wave velocity is the most precise measure of arterial stiffness and an independent predictor of cardiovascular events. Habitual coffee consumption is associated with lower pulse wave velocity in multiple population studies, including an analysis of the UK Biobank with over 100,000 participants. The combined mechanism of endothelial nitric oxide, reduction of vascular inflammation, and lower LDL oxidation contributes to preserving the arterial elasticity that naturally decreases with age. The inflammation mechanism in detail. Atherosclerosis is fundamentally an inflammatory disease, not simply the passive accumulation of fat in arterial walls, but an active process of chronic inflammation recruiting immune cells, oxidizing LDL and generating atherosclerotic plaque. Chlorogenic acid from coffee directly inhibits the NF-κB pathway, the master switch of cellular inflammation, controlling the production of dozens of pro-inflammatory molecules. Coffee polyphenols modulate the gut microbiota toward an anti-inflammatory profile. Caffeine has additional anti-inflammatory properties via adenosine receptor blockade in immune cells. The reduction in CRP, interleukin-6, and TNF-alpha documented in habitual coffee consumers translates, over time, into arteries with less plaque and less vulnerable to rupture. Coffee in the context of comprehensive cardiovascular health. No single food or beverage transforms a person's cardiovascular profile. Coffee is a well-documented adjunct within a cardiovascularly healthy lifestyle that includes regular physical activity, the most impactful factor, not smoking, weight management, adequate 7 to 8 hour sleep, chronic stress management, and a diet based on real foods with predominantly vegetables, fruits, legumes, and lean proteins. Within that context, black coffee without sugar is one of the easiest habits to maintain with the best pleasure-to-benefit ratio that exists. It requires no sacrifice, is affordable, culturally integrated, and now backed by the best available evidence. 7 mechanisms, 3 million participants, 1 consistent conclusion. Black coffee in moderation, your circulatory system's daily ally, backed by modern cardiovascular science. God bless you and give you much health. Until next time. The American coffee culture and optimal preparation for cardiovascular benefit. American coffee culture has evolved dramatically from the classic drip-filtered pot to espresso-based drinks and cold brew. From a cardiovascular perspective, the preparation method matters more than many realize. Paper filter drip coffee, the classic American method, is the preparation with the most favorable cardiovascular profile because it removes diterpenes while preserving polyphenols. Cold brew, increasingly popular, preserves polyphenols and has lower acidity, making it an excellent alternative for those with acid sensitivity. Espresso, while concentrated, is consumed in small volumes and the diterpene exposure per cup is relatively low. The large chain coffee drinks loaded with sugar syrups, cream, and flavorings bear little resemblance nutritionally to the black coffee studied in cardiovascular research. The sugar and saturated fat in these preparations can offset and exceed the cardiovascular benefits of the coffee itself. For maximum cardiovascular benefit, drip filtered black coffee or cold brew, without sugar or with a non-caloric sweetener if needed for palatability. The dose-response curve and optimal consumption. The cardiovascular benefit of coffee follows a dose-response curve that has been consistently characterized across multiple large-scale studies. From 0 to 1 cup daily, there is a rapid rise in benefit. From 1 to 3 cups, benefit continues to increase. At 3 to 5 cups, the benefit plateaus. Above 5 cups, the benefit persists, but the curve flattens and in some studies shows slight attenuation, though not harm, at very high intake levels above 8 cups daily. The optimal range, based on the totality of evidence, is 2 to 4 cups of filtered black coffee per day. This is the range that the Circulation 2022 meta-analysis identified as associated with the greatest cardiovascular protection while remaining practically sustainable as a daily habit. The coffee and heart failure connection. Heart failure, the progressive inability of the heart to pump blood effectively, is one of the most prevalent and debilitating cardiovascular conditions in older adults. The 17% reduction in heart failure risk associated with habitual coffee consumption in the Circulation meta-analysis is one of the most clinically significant findings in the entire body of coffee cardiovascular research. The proposed mechanisms include the anti-inflammatory effect, reducing cardiac remodeling, the endothelial improvement reducing afterload on the heart, and the metabolic benefits, including lower diabetes risk, reducing one of the primary drivers of heart failure in the general population. For the over 60 audience where heart failure risk is highest, this particular benefit of coffee deserves special attention. The caffeine tolerance phenomenon in detail. For habitual coffee consumers, defined as consuming at least 1 cup daily for 4 or more weeks, the acute cardiovascular effects of caffeine are largely abolished by tolerance. The heart rate elevation seen in first-time or occasional consumers is minimal or absent in daily drinkers. The transient blood pressure elevation is similarly reduced. This tolerance operates at the receptor level. Chronic adenosine receptor blockade by caffeine leads to upregulation of adenosine receptors, which compensates for the blockade and restores baseline cardiovascular function. The practical implication is that the acute cardiovascular monitoring studies that measured negative effects of caffeine in naive subjects are largely irrelevant to the chronic cardiovascular outcomes of regular consumption. The epidemiological literature captures the chronic reality, and that reality is protective, not harmful. 7 mechanisms. The best epidemiological evidence. Black coffee and your circulation. A partnership backed by modern science. God bless you and give you much health. Until next time. The updated guidance from cardiovascular societies. Both the American Heart Association and the European Society of Cardiology have removed generic coffee restrictions from their cardiovascular prevention guidelines in their most recent versions. The current position reflects the accumulated evidence. 2 to 5 cups of filtered coffee per day do not increase cardiovascular risk in adults without specific contraindications, and the evidence suggests modest but consistent benefit in that consumption range. The outdated advice to avoid coffee for cardiovascular reasons, which persisted in clinical practice long after the evidence shifted, is being corrected as cardiologists update their knowledge. If you have been restricting coffee based on old medical advice, it is worth revisiting that conversation with your cardiologist in light of the current evidence base. What specifically to ask? Has the recommendation to avoid coffee been updated given the Circulation 2022 meta-analysis and the JACC electrophysiology systematic review? Most cardiologists practicing evidence-based medicine will confirm that moderate black coffee consumption is now considered neutral to beneficial for cardiovascular health in the general adult population. A final practical summary for the over 60 audience. The cardiovascular risk period for people over 60 makes the protective effects of coffee especially relevant. Endothelial function declines with age. Arterial stiffness increases. inflammatory markers tend to rise. LDL oxidation is more prevalent. Coffee, through its documented effects on all 4 of these pathways, is a daily habit that works against the cardiovascular aging process, specifically in the dimensions where aging causes the most damage. 2 to 3 cups of black filtered coffee per day is one of the most evidence-supported, accessible, pleasurable, and sustainable cardiovascular health habits available to adults over 60. 7 mechanisms, 3 million participants. 1 conclusion: black coffee and your circulation are natural allies, and modern cardiovascular science confirms it. God bless you and give you much health. Until next time. Coffee as part of the Mediterranean and DASH dietary patterns. Both the Mediterranean diet and the DASH diet, the 2 most evidence-supported dietary patterns for cardiovascular protection, are compatible with moderate coffee consumption. Neither pattern restricts coffee, and several Mediterranean pattern population studies have found that coffee contributes meaningfully to the total polyphenol intake in coffee-drinking populations. In Italy and Greece, countries with the strongest Mediterranean diet adherence and among the lowest cardiovascular mortality rates in Europe, moderate coffee consumption has been part of the cultural dietary pattern for centuries. The cardiovascular benefit of coffee appears to work synergistically with these broader dietary patterns. The anti-inflammatory effects of a polyphenol-rich diet are amplified by the additional anti-inflammatory contribution of 2 to 3 daily cups of coffee. The combination of a Mediterranean-style diet and moderate black coffee consumption represents one of the most evidence-rich strategies for cardiovascular protection available to adults. It is also one of the most sustainable and pleasurable, which matters for long-term adherence. God bless you and give you much health. Until next time. 7 mechanisms. 3 million participants. 1 consistent conclusion. Black coffee in moderation is your circulatory system's daily evidence-based ally. God bless you and give you much health. Until next time. Enjoy your coffee with the full backing of modern cardiovascular science. 7 mechanisms. Your circulation. 1 daily cup. God bless you. Until next time with more evidence-based cardiovascular tips. Amen. Black coffee, your ally.